So I would like to tell about the telemedicine project that we are having in our hospital and what we reach and what is about. So for our guests that are here to introduce our hospital, this is the largest healthcare institution in Lithuania. It's established in 1940s. At this moment there is more than 1,000 doctors working in our hospital. 450 of them are PhDs, and we have more than 2,000 nurses. We have 38 departments, 4 affiliate hospitals, and 230 beds in all our campus of hospital. What is the telemedicine? The telemedicine is a topic that was also interesting for the publicity in media. The very important journal of Wall Street Journal in 2016 had an article that was giving the attention to this new facility for the medicine. And the first sentence that they are saying in 2016 that it's already here. And it's facilitating the physicians and patient communication with helping to make a patient's visit not directly with a physical contact, and also physician to physician communication that allows to spread the knowledge to the different centers. And it allows better care where the medical experience is unavailable. In 2015, there was about 1 million numbers of virtual doctor visits in the United States, and in 2016, it already was 1.2 million. I don't have a new data, but I think that they are increasing a lot. And during that time, 72% of hospitals had projects with the telemedicine. So what is a telemedicine in like a background? Telemedicine uses information and communication technologies that overcome geographical barriers and increase access to high-end healthcare services independently of distance. There is 4 key elements of this project. It's to provide clinical support, overcome geographical barriers, different modalities, and healthcare equity around the world. This helps with the telemedicine. Our institution has a telemedicine in hematopoietic stem cell transplantation, which is like an institution-to-institution cooperation, the physician to physician. And it helps us first improve patients' care, developing more modern and expertise protocols, and also we have faster collaboration for new therapeutic options, and also fast-track advices in complicated clinical situations. So each of one can make us a difference, but only together we can make a change. Our project was started in 2012. Then I went to the Leipzig for the training. It was a JACE accredited center where could we see the most advanced technologies for the hematopoietic stem cell transplantation. During that period from 2012 and 2018, our hematologists were trained. Many of us were in Leipzig, ranging from 2 weeks to 6 months. And also our medical biologists went there, so we can speak one language, we understand each other. The key elements for the establishing hematopoietic stem cell transplantation in our hospital was establishment of core facilities in our hospital. This is facilities for the patients, 11 beds, special wards with the HEPA filtrations that was opened in 2014, and also hematopoietic stem cell collection and progressing facilities with cryopreservation, which are opened also in 2014. To make a telemedicine project possible, we had to make a site visit of the coordinators. It was Professor Nidavisa, who was visiting us quite regularly, and this allowed us to start this project. I think the most important thing is the local team that can do that independently and with the support from the supervisor. And also we started a program with the supervising of Professor Nidavisa in 2015 with an experienced director with a protocol in place. So how it works? It's a daily conferences that are made with a teleconference by the computer. We share and discuss all the laboratory results, radiological findings, clinical data, and we do it regularly and every day to discuss and to make our care as good as it possible and as safe as possible for our patients. What is the benefits for our patients? They can get highly experienced care close to their home. They get experience more than decades for who's working in a field of a bone marrow transplant. They can stay closer to their families. They have less stress, less expenses, and they feel much comfortable than going some far away. Patients are also consulted with the professionals. How I said, it's with the decades of experience in this field. The doctors are also benefiting from this project a lot because we have a fast-track advices and reliable, and during discussions we get education process continuously. So our results during that project, we already did more than 60 transplants. When I was doing this presentation it was 60, and now it's 63 transplants in the last week. And the most important and our main spot is to be the safe for the patients. And this cooperation is also adverted like a World Health Organization, like a model for implementing bone marrow transplantation in other places. So we had 60 transplants, 55 patients. Most of the patients are transplanted because of multiple myeloma. 5 of them had tandem transplantation. We had 1 patient with the POEM syndrome and also 3 autologous transplantation for the lymphoma patients. Our range of the patients ranging from 18 to 72 years old. We have almost equally having males and females. And most of our patients has a good performance status as they should. For this quite intense treatment, ECOG performance status 0 and 1. A few patients has more, especially the severest patient was the POEM syndrome patient. That is no other treatment modalities for he could be suggested. And age distribution, most of the patients are between 50 and 65 years old. But we even have almost 20% of older patients, older than 66 and 80%. What is our treatment standard for the multiple myeloma? Because we are doing it mostly for these patients. Most of them get a treatment. It was a little bit before our standard. Earlier standard, it was CBORDEX treatment and CTD and also VTD, which is now becoming the key treatment options for our patients. And we also had few patients with the bendamustine and bortezomib treatment, especially for the patients who had the kidney injury. What kind of responses we have? About half of patients during this treatment got VGPR, and about 31% get a complete response during this induction treatment before the transplant. Our mobilization has been changed when we started our project, because at the beginning for the first 4 patients, we used 2 grams first day and GCSF a lower dose. And we had to use prelixafor injection, which is our not very good practice. It's good practice when it needed, but it's not a good practice when you have 50% of the patients with prelixafor. And after the introduction of the protocol from the Hospital of Leipzig, we decreased the use of prelixafor till 6% for the patients. This decreased the price of our procedures a lot. So also about our freezing. So when we collect, we have to freeze the cells. We are using 10% DMSO solution and patient plasma. About our engraftment very shortly, it's very similar to what we have in the literature. Leukocytes are coming back. Usually the median is on the day 11, and the platelets more than 50 on the day 15. We had 2 patients which had to go to the intensive care unit during our program. And responses after that transplant, actually we have the slide where we can see that we have, after the transplant, we increase the number of patients who has a complete response, also with GPR, and there is less patient who has partial response. So we are gaining in the response and the answer to treatment a lot for the patients during this treatment modality. Our event-free survival, you can see the curves. We lost some patients. Most of these patients died of disease relapse, and in general, our survival data are a little bit too early to make statements of the numbers of what we have of survival. So in conclusion, this project led by Professor Niederwieser allowed us to establish effective new hematopoietic stem cell program in our hospital, and innovative model of spreading knowledge, know-how, and experience in the field of hematopoietic stem cell transplantation can serve as excellent example of future cellular therapies cooperation projects. This is our team with Professor Niederwieser, and we are all trying to do our best for our patients. And for the end, if you can laugh together, you can work together. Thank you.